As a physician, you know that dry eye syndrome is one of the most common problems you see among patients.
Over the period of my career, I've treated over 1,000 dry eye patients.
Caused by insufficient lubrication in the eye, it's also an easy problem to treat.
Very quick, very easy, and painless.
In the next few minutes, we'll show you how simple it can be to treat dry eye syndrome with one quick, easy step, using Odyssey Medical's unique, patented Parasol punctal occluder system. Millions of Americans, as many as 1 in 5 of your patients, suffer some form of dry eye syndrome. It occurs in nearly 3/4 of people over age 65. Among the numerous symptoms, itching, burning, redness, blurred vision, and decreased contact lens tolerance. You can test patients for dry eye syndrome using various diagnostic tests, such as glycemine green, Zone Quick, and BioGlow fluorescein sodium strips. For some patients, artificial teardrops may be the answer, but these drops may require frequent usage and become costly over time.
I think that they're more of a headache than a help, because you're constantly having to drop them, and the relief, it doesn't last very long.
A better remedy is punctal occlusion, placing tiny plugs in the puncta to block tears from draining into the canaliculus. Odyssey offers 3 levels of dry eye therapy: temporary collagen implants for 7 to 10 days, extend synthetic implants for use up to 3 months, and the Parasol plugs for long-term occlusion. To find out if a patient might benefit from punctal occlusion, first consider using one of Odyssey's dissolvable implants. Odyssey's temporary collagen implants provide relief for 7 to 10 days before dissolving, so patients can experience the comfort that occlusion will provide. In some cases, patients may require intermediate occlusion. Odyssey's Extend absorbable synthetic implants provide occlusion for up to 3 months for dry eye conditions from causes such as temporary medications or surgeries performed on the eye. If long-term occlusion is needed, Odyssey's Parasol punctal occluder is the answer. It offers several distinct advantages to you and your patients. Its unique patented design makes it easy to insert, provides simple sizing, and is backed by a 30-day pop-out guarantee.
My eye doctor suggested that we try these plugs, and it has absolutely changed my life. I am able to wear contact lenses. My eyes are not dry. I can't say enough good things about the plugs.
First, take a look at how quick and easy they are to insert, using a high-quality insertion instrument designed specifically for the Parasol occluder. Hold the inserter between your thumb and forefinger, with your finger near the release button. Be careful not to press the button too soon.
All I'm going to do is pull your lower lid down a little bit. Just want you to look up towards the ceiling.
Gently insert the Parasol plug into the punctum until the dome is flush with the lid margin. Then press the release button. After insertion, carefully inspect the punctal area to confirm the Parasol plug has been properly placed. The self-dilating Parasol is the only punctum plug with a hollow nose that collapses on insertion. In most cases, punctal dilation is not necessary. This makes it easier on you and more comfortable for your patients. After insertion, the umbrella-like flanges expand to provide a secure and comfortable custom fit within the patient's canaliculus.
There is no pain. It's very fast. He just goes in there and puts it and pushes it down, and it's over. And you're kind of sitting in the chair going, is that it?
The Parasol's unique design allows for simple sizing. You only have to stock 2 sizes, small and medium, to fit virtually all your patients. A large size is also available. That's a stark contrast to other plugs that require you to stock up to 9 different sizes and take precise measurements of the punctum to confirm a correct fit.
And in the past, with some manufacturers, we've even had to use gauges to determine what size of plug fits best. With the Odyssey plug, it's easy to go to the cabinet and get 1 or 2 different size plugs, and you know it's going to fit the first time.
The Parasol's revolutionary design also solves perhaps one of the most irritating problems reported by both patients and physicians: spontaneous extrusion. Because the Parasol is designed for excellent retention, Odyssey offers a 30-day pop-out guarantee. If a plug pops out within 30 days of insertion, Odyssey will replace it free of charge. Should you need to remove a Parasol for any reason, simply use forceps to grasp the plug immediately beneath the exposed dome and gently pull upwards using a slight rocking motion. The flange is designed to turn inside out like an umbrella in the wind. Parasol punctal occluders are available in 3 convenient packaging options: sterile preloaded, sterile quick load, and non-sterile bulk pack. Preloaded sterile occluders are sold in pairs already mounted on insertion instruments. Sterile quick load occluders come in 8 pairs per box, mounted on a special plug stand for quick loading. Or for the greatest savings, the non-sterile bulk pack contains 10 polybag pairs per box. Reusable insertion instruments are sold separately for use with the sterile quick load and non-sterile bulk packaging configurations. To load an occluder onto the inserter using the quick load plug stand, gently guide the inserter pin into the hole on the dome end of a plug. Then slide the inserter up and away from the plug stand. If the plug is not completely loaded onto the wire, gently tap the plug into the cone-shaped dimple located in the center of the plug stand to ensure the plug is properly loaded. To load an occluder from a bulk bag, use forceps to hold the shaft of the plug while carefully guiding the inserter pin into the dome end. Once the occluder is about halfway onto the pin, move the forceps onto the nose portion and push until the pin is completely in, being careful not to tear or puncture the plug. Or you may simply load the occluder onto the inserter directly from the bag. For your convenience, with each pack of occluders, Odyssey provides handy peel and stick labels with the plug size, lot number, and coding information. They can be easily applied to a patient's file, billing record, or surgery notes. These op notes are also useful when communicating with our customer service department.
Good afternoon, Odyssey Medical.
Odyssey Medical's friendly customer service representatives are available by phone and email to answer any questions you might have or take your orders. The company custom makes, by hand, the Parasol plugs using its own state-of-the-art manufacturing facility. Odyssey Medical was founded in 1995 in Memphis, Tennessee by Gary and Barbara Taji.
We're very proud of the products we make at Odyssey Medical, and that's because we control all aspects of the process, from design, manufacturing, marketing, sales, and distribution to the doctor. Our quality is so high because we make each implant one by one with a proprietary process. That's what sets us apart from the competition and why we have the best implant on the market.
For treating dry eye syndrome, the Odyssey Parasol punctal occluders are the best, most cost-efficient solution for you and your patients. They're easy to insert, made for simple sizing, and come with a pop-out guarantee.
A lot of physicians think that punctal plugs are difficult, but they're really not. Odyssey makes it easy, and it's really helped me to build my practice.
For more information or questions about the Parasol punctal occluder and other Odyssey products, or to place an order, call 1-888-905-7770 or check the website www.odysseymed.com.